The hospital was built by the community. They got together because there was a problem and they addressed it. And the community's been providing direction to this organization throughout that time.
The hospital, which grew into the healthcare system, was first started 100 years ago in response to the influenza pandemic. And since then has grown and thrived to our current iteration. We have added Princeton House Behavioral Health, home care, various specialties and programming, built a new facility, and became part of the Penn Medicine family. And all of this was done in response to the needs of our community.
When you think about how much has changed from that farmhouse to today, we've obviously learned how to listen. We've learned how to respond to change.
And if you're going to become a leading community, if you're going to provide the environment where people want to live and work, you have to have a great hospital.
With increased technology, with advances in medicine, we've really kept up with the times and we've moved in the direction that we've become very, very sophisticated in terms of the services that we can now offer. Services that years ago were only offered in tertiary institutions.
Princeton House Behavioral Health has been a part of Princeton Health since 1971, and we've grown exponentially since our inception, adding programs, services, and locations to meet the needs of mental health and addiction treatment services throughout New Jersey. There's a spirit and a soul here. There's a culture of caring, respect, and dignity that our patients continually express that they've experienced through the care they receive.
If you are actively listening to your patients, then you can clearly hear what they are going through. Some patients may not be able to express or articulate what they really need or how they really feel that day. But if you are an active listener, you can feel it in your heart.
I think almost everybody has a story to tell about their experience at the hospital.
I first started out interested in the hospital because my son is 30 years old that has autism, had to come in. He got sick one night and had to come in an ambulance. And we thought he'd be really scared, but the staff and the doctors and everyone in the emergency department were absolutely wonderful with him. And even though he's nonverbal, he had a very positive experience.
I work for Penn Medicine Behavioral Health Services. My family history at the hospital goes way back. It begins with my grandmother. She was here for over 20 years. My mother worked here for over 25 years. My mother met my father here. He worked here for over 20 years. Met my wife here. We've been married for 19 years. Altogether, I've had over about 25 relatives work here. It's a strong sense of pride for me being here, working at the hospital. And it just stems from over the years of just doing what's right and doing the best you can every day.
It's a tremendous honor and satisfaction to be able to take care of somebody. For somebody to come into the hospital and literally put their life in your hands. There's nothing like being able to do surgery on somebody and then a month later you're walking through McCaffrey's and somebody taps you on the back and you realize it's your patient. It's truly indescribable.
My first patient experience at Princeton was the birth of my oldest daughter, Carmen Liliana Butts. And it was a very, very emotional time for us, being our first child. And she was born with a little bit of a complication with her heart. And she had really a hard time in the first couple of days of life. And the neonatologist there became like my best friend. I mean, every night, I would go have a conversation with him. I was comforted. I became more knowledgeable, which helped me articulate what was going on to my wife and our parents and family members and friends.
We set out to replace our old hospital and found a terrific site in Plainsboro. We were fortunate to find 170 acres, and it gave us an opportunity to do a lot more than just create a new acute care hospital. When we put together our plan for developing this campus, we expected to have a $1.2 billion financial impact on economic growth in the region around us. And it looks like that's happened.
So today they're a world-class hospital facility, serving not just the Plainsboro and Princeton, but serving the entire region. We're delighted with the benefits they provide to the community, not just the health benefits, but the benefits they provide economically to the community and to the region.
When I think about our primary responsibility, which is really to help people be well, physically and mentally. We never lose sight of that. And in addition to that, we're an employer. We support 3,500 employees. We have 800 volunteers. We have 1,300 physicians, and they're all part of the community. With all of the changes we imagined, we chose to be part of the University of Pennsylvania health system.
Joining Penn Medicine, Princeton became part of a continuum of care that spans from the ambulatory clinic to the doctor's office to home care to a community hospital to one of the most advanced hospitals in the entire world. And it's an opportunity for a patient to get the right level of care at the right place at the right time.
I have big dreams for Princeton. I see it as the leading provider in Central Jersey or even the entire state. I have big dreams for it. And I know we can do it.
I just hope that we will continue to develop a closer and closer coordination with Penn so things will become absolutely seamless and that we will continue to benefit from all of their advances and they will continue to benefit from a first-class presence in the central New Jersey region.
My hope for the future is that we continue to provide exceptional, compassionate care that enhances the health and well-being of our patients, their families, and our community. That's our mission.
My hope is that every person that lives in central New Jersey looks back on the moment that Princeton joined Penn Medicine and said that was a great idea, it was a great concept, but more importantly, they've executed on that promise and have brought cutting-edge science, fantastic patient care to everybody on the East Coast.
Our current strategic plan is designed to take advantage of the resources that we've put in place over the last 2 decades, whether it's the campus, the hospital, the partnership with Penn, and the resources they've put together over more than 250 years, coupled with the talents of the volunteers and the employees and the physicians who work here. The changes that will take place in the next decade, in the next 5 years, are going to be extraordinary. Virtually everything you'll ever need in terms of health care and in terms of your wellness will be available to you through Princeton Health. The future's incredible.